Hello, dear aspirants. Welcome you all to the Master Nursing classes. Here in this particular video, this short video, we are discussing the very important one test, that is the caloric testing. Yes, this is the test where they have asked in your KGME exam, and the very important test to know to assess the eighth cranial nerve function. This caloric test we also called as in cold caloric test or hot caloric test because we use this here in cold water or hot water to testing the this particular test. And this caloric test is also called as an oculovestibular reflex. Okay, what we call this is also an oculovestibular reflex. Simply we call this oculovestibular reflex because of so when we insert the cold water and hot water inside the ear, okay, so it stimulates the vestibular nerve. Okay, it stimulates the vestibular nerve. Okay, so we call this is an vestibular. So after stimulating the vestibular nerve, there should be a response in our eyes. That response includes the nystagmus, means right to left, left to right movement of the eye. Means what is the nystagmus? Nystagmus is involuntary uncontrolled movement of eyeball right to left, left to right, and in any direction, so which is involuntarily and uncontrolled. So that is what we call voluntary. We are moving means that is voluntary. It is involuntary means without any voluntary initiation the eyeballs moves rapidly right to left, left to right, like this. So that is what we call the nystagmus. When we insert here the cold water or hot water, okay, cold or hot water or the warm water, so it stimulates the vestibular nerve and there should be response. If the response is present means our, yes, the vestibular nerve is working normally. So how we identify that? Based on the ocular manifestation. So we call this is an oculovestibular reflexes. And when we stimulate the vestibular nerve, the balance should be altered. So if there is no any alteration in the balance means the vestibular nerve is not working properly. So this is what the oculovestibular reflex. Let me go in detail related to the oculovestibular reflex. Okay, here is the our beautiful ear. Okay, this is our external auditory canal. Okay, so means our external ear part. So here is our beautiful tympanic membrane. Okay, and inside attaching to tympanic membrane there is malleus bone is there. After the malleus there is incus bone is there. After the incus there is a stapes bone is there. Friends, the examiner asked the question from here also, what is the sequence of the ear ossicles? Sequence of the ear ossicles is your miss. First malleus is come, after that incus, then yes, it's our stapes. The smallest bone of our body is the stapes. And when they ask the muscle, smallest muscle of our body, they are asking is that is the stapedius muscle, the muscle which is helpful for the holding the stapes bone. The smallest bone of the body is the stapes and the smallest muscle of the body is stapedius. Okay, the sequence of the ear ossicles the examiner asking means you have to say in the sequence of miss. First malleus will come, after incus, after that the stapes. Okay, this is the sequence of the ear ossicles. Okay, and this is our external auditory canal. Okay, to do this test, this caloric test and oculovestibular test, there should be no any obstructions in the external auditory canals, because when we want to stimulate the vestibular nerve, so it should directly stimulate the tympanic membrane. If there is any obstruction here means the cold or hot water will not stimulate the tympanic membrane and which it will not go until the vestibular nerve. So the result will come false. So because of that, make sure that before doing the caloric testing or oculovestibular reflex, our external auditory canal should be clear. Okay, there should be no any obstruction. Oh, that is a very important one. Okay, so let me discuss in detail related to the oculovestibular testing or the caloric test. Okay, very important. The purpose why we will do the caloric testing is to assess the balance and in order to assess the functioning of the whether the brainstem is functioning normally, whether the vestibular nerve is functioning normally. In order to assess the balance and the function of the brainstem and vestibular nerve, we will do the cold caloric test or the oculovestibular test. So this is the question that was asked in your KGME exam. The purpose of the doing the caloric test is to assess the balance. Okay, a very important one. Okay, here is the procedure. First, arrange the all required articles that includes your hot water or the warm water and cold water. So we are using the hot water and cold water here. Because of that, this caloric test is also called as the cold caloric test or warm or hot caloric test. Also very important one. Okay, and check the patency of the external auditory canal. Okay, we should check the patency of our external auditory canal or our outer ear canal, so it should be out of the obstruction. Okay, so and give the supine position with the head of the bed elevated to 30 degree. Give the supine position with head of the bed elevated to 30 degrees, so that we can do the procedure very easily and the patient should be in the comfortable position. Okay, and instill the hot water and the cold water, very important one. Any one will instill at one time. Okay, one will instill at one time. First we will instill the cold water. Okay, then after that we will do the hot water. Okay, so after instilling the any cold water, okay, check for the response. So after we instilling the cold water inside the ear, the person should lose his balance. That is the ಪರ್ಸನ್ಗೆ ಚಕ್ಕರ್ ಬರ್ತದೆ. ಚಕ್ಕರ್ ಬಂದ್ರೆ ಅದಕ್ಕೆ ಏನ್ ಹೇಳ್ತೀವಿ ನಾವು ವರ್ಟಿಗೋ ಅಂತ ಹೇಳ್ತೀವಿ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಒನ್. ವಾಟ್ ಇಸ್ ದ ವರ್ಟಿಗೋ? What is the vertigo? Is the, yes, the person will feel the rounding sensation of his entire own brain. That is called as the vertigo. Okay, and there should be an nystagmus present. So if the vertigo and nystagmus present means, so that is the normal vestibular nerve functioning is there, means the normal brainstem also functioning normally. Okay, very important. If when we install the cold water, there is no any response. After installing the cold water, no any response means the brain stop responding. So the brain is damaged. The brain is the dead. Okay, the vestibular nerve is damaged. Okay, ಸೊ ದಟ್ಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ನಾವು ಯಾವಾಗ ಕೋಲ್ಡ್ ವಾಟರ್ ಇಯರ್ ಅಲ್ಲಿ ಹಾಕ್ತಿವಿ ಅವಾಗ ವರ್ಟಿಗೋ ನಿಸ್ಟಗ್ನಸ್ ಆಗಬೇಕು. ಆಗಲಿಲ್ಲ ಅಂದ್ರೆ ಅಲ್ಲಿ ಬ್ರೈನ್ ಡ್ಯಾಮೇಜ್ ಆಗಿದೆ ಅಂತ ಅದರ ಅರ್ಥ. ವೆಸ್ಟಿಬುಲಾರ್ ನರ್ವ್ ಡ್ಯಾಮೇಜ್ ಆಗಿದೆ ಅಂತ ಅದರ ಅರ್ಥ. ಓಕೆ, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಒನ್. ಓಕೆ, ಸೊ ನಿಮ್ಗೆ ಗೊತ್ತಿರಬೇಕು ವೆಸ್ಟಿಬುಲರ್ ನರ್ವ್ ಫಂಕ್ಷನ್ ಏನು, ಆಮೇಲೆ ಏನಂತೇಳಿ ನಮ್ದು ಕಾಕ್ಲಿಯರ್ ನರ್ವ್ ಫಂಕ್ಷನ್ ಏನು, ಇವೆರಡು ಕಲ್ತು ಬಿಟ್ಟು ಏರ್ತ್ ಕ್ರೇನಿಯಲ್ ನರ್ವ್ ಮಾಡ್ತೇವೆ ನಮ್ದಕ್ಕೆ. ಅದನ್ನ ನಾವೇನ್ ಹೇಳ್ತೀವಿ, ವೆಸ್ಟಿಬುಲೋ ಕಾಕ್ಲಿಯರ್ ನರ್ವ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಓಕೆ, ವೆಸ್ಟಿಬುಲರ್ ಕಾಕ್ಲಿಯರ್ ನರ್ವ್, ದಟ್ ಇಸ್ ದ ಅವರ್ ಏರ್ತ್ ಕ್ರೇನಿಯಲ್ ನರ್ವ್. ಓಕೆ, ಸೊ ವೆಸ್ಟಿಬುಲರ್ ನರ್ವ್ ಇಸ್ ರೆಸ್ಪಾನ್ಸಿಬಲ್ ಫಾರ್ ದ ಬ್ಯಾಲೆನ್ಸ್ and cochlear nerve is responsible for our, yes, the hearing process. Very important. So including these both vestibular nerve and cochlear nerve, which makes the eighth cranial nerve. Okay, vestibular nerve supplies our, is the beautiful vestibula, and cochlear nerve supplies to the, yes, the cochlea. Very important. So this is what, how you will do the, yes, the caloric test or the oculovestibular response. See, here is the beautiful with the tricks conditions. Here is the normal condition. Okay, so here is one person. In his right eye we are instilling the cold water, so his eye movement is away from the, yes, the instilled side, means his, yes, his eyeballs are moving out of the, or the away from the instilled area. Now right ear ಅಲ್ಲಿ water instill ಮಾಡಿದ್ವಿ, so eyeball movement is there at the left side, means his, he is showing the opposite response here. Okay, ಇಲ್ಲಿ ಕೂಡ ನಾವು ಲೆಫ್ಟ್ ಇಯರ್ ಅಲ್ಲಿ ಕೋಲ್ಡ್ ವಾಟರ್ ಇನ್ಸ್ಟಿಲ್ ಮಾಡ್ತೀವಿ. ಸೊ ವೆನ್ ವಿ ಇನ್ಸ್ಟಿಲ್ ದ ಕೋಲ್ಡ್ ವಾಟರ್ ಇನ್ಸೈಡ್ ದ ಲೆಫ್ಟ್ ಇಯರ್, ದ ಐಬಾಲ್ ಮೂವ್ಮೆಂಟ್ ಈಸ್ ಗೋಸ್, ಎಸ್, ದ towards the right side, means to the cold water opposite response is there. To cold water opposite response is there. Okay, so when we instill the warm water, see, we are instilling the warm water at the right ear, and the eyeball movement is there at the right side only. Okay, here we instill the warm water in the right ear. Okay, so the eyeball movement is there at the right side only. Okay, sorry, left side. Left ear we instill, means the eyeball movement is there at the left side only, means the same side is there in the warm water. So to remember this one, we are having the simple tricks of the cows. Okay, cows means in the cold water when we instill, the eyeball movement is the opposite side. When we instill the warm water, the, yes, the eyeball movement is in the same side. To remember this one, we have the mnemonic as cows. So that is the normal response. Okay, the normal response. If no any response. If there is no any response after instilling the cold water, warm water means the brain stem is damaged, means the or the vestibulocochlear nerve. Among this vestibular nerve is got damaged. So we will do the the hearing test to assess the cochlear nerve function. Okay, so that we will discuss in the different class. Okay, this is how we interpret the the cold caloric test, also we call the oculovestibular reflex. Thanks for watching the video. If you are new to my channel, please subscribe to my videos. You will get notified for the further informative video for your NORCET exams and other very important nursing competitive exams. Thanks for watching the video completely. Thank you, sir.